A lot of people feel very anxious about getting an autism assessment, especially as an adult. And so I'm going to go through my process to try and demystify it a little bit for people and hopefully decrease anxiety. Hi, my name is Dr. Erin Miggantz. I'm a licensed clinical psychologist and I specialize in the assessment of adult autism. However, I want to note that any information that I provide here on TikTok is simply for educational purposes or my own opinion or my way of going about assessments. Other providers and other people who do adult autism assessments may have a very different process, and that is completely okay. I think that everyone does this in the way that works best for them and the way that they believe works best for their clients. So I schedule 4 different appointments. The first one is a 60-minute intake session. During that session, what we do is I just get to know the client. I ask them about their background, psychiatric history. They've already completed a form that gives a general background of things that they've been through and mental health and developmental history, and then I go in and just sort of fill in the gaps and ask them additional questions. And this lets me know which self-report assessments I want to give them and what other potential conditions I might want to assess for. The second appointment is a 2-hour appointment, and that's when I use the qualitative clinical interview that I use to assess for autism. Even if the patient is being assessed for ADHD as well, I usually do the autism one first. Really, it's nothing out of the ordinary. I ask about sensory sensitivities, I ask about repetitive behaviors, repetitive thoughts, things like that. Things you would expect with autism, difficulty with change, how someone is socially, whether their reciprocity is good in conversations. I don't believe that you can see autism in highly masked adults. People may come at me for this, but there are certain tests that happen to be observational in nature. So basically, if you make eye contact, if you don't look autistic, you're not going to be diagnosed with autism, and I find that to be inaccurate. I schedule a third session. It's usually 60 minutes, and if they're just doing an autism assessment, I'll use this appointment to either complete the autism measure if we didn't complete it in the first 2 hours, or if I think there's something else additional going on, if I think there's ADHD, if I think there's bipolar disorder, anything else that could be causing the current symptoms that they're coming in with, I will use that time to assess for that. I also will speak with loved ones of my client's choice. I do not require it to be parents. The reality is with adults, oftentimes parents may not be around. They may be estranged, they may be deceased. If I can talk to a parent and they want that person involved in their assessment, then great, I'll speak with them. But I also will speak with friends, I'll speak with partners, I'll speak with children, whomever the client wants to be involved in their assessment. This is getting really long. Go to part 2 for more.